And we're usually starting with the show, with the podcast, not only going with question by question, but also talking like this, you know. So we just started with the podcast. Perfect. And don't worry about anything. So Maјka Grživnovich, always a bit hard to pronounce Polish.
You did very well.
Names, but yeah, you think so? Okay, so first time in Skopje, huh?
It is my first time, yes. Thank you for having me.
Thanks for coming, even though you're a bit late because of all this busy schedule we had today.
Hera kept me very busy. So.
Yeah, but this is kind of like relaxed show, so don't worry about anything.
Just
take a time to relax in this show, in this video podcast we're making. This is an episode, I think, number 14. Yeah, I think so. This is how the main guide man in the show is actually counting his shows. Yeah, this is how it goes.
A lucky number.
Yeah, 14. Yeah, it's not 13. So how do you like Skopje?
It's lovely.
It's only 2 days. You cannot. You're coming in a tough period.
Yes.
Of living in Skopje, but on the other hand, you can see some nice stuff like old bazaar. Or you didn't have any.
We haven't had a chance yet to go there. I was jumping from one meeting to another.
You're like a musician. So we were talking about this before we started with the show. When I go on a tour, they're saying to me, how was it like in Prague? How was it in Berlin? I didn't saw nothing from it.
Exactly. I could say exactly the same. So usually it's from the airport to the hotel to a meeting place or between meetings and back to the hotel and the airport.
I think you should, as one of the working people in this area should take like a day before all of these meetings coming. We used to do that with my band, take one day before the show. Yes. So you can take
See
a walk around the city.
Yeah, it's a very good advice.
Have it in mind in the next travelings. So Maјka Grživnovich, let's say if I do it right, sorry if I do not, and sorry about my English, it's not that perfect, but I will do my best to do this show as perfect as I can.
And thank you for using English. I don't speak Macedonian, so
maybe we can do next time a Macedonian Polish one.
Brilliant. So let's try that out.
I think that even in Macedonian or Polish language, if you do it like slowly, that people will understand everything from the one and the other side.
Deal.
So International Planned Parenthood Federation European Network Regional Director. I needed like 2 minutes to pronounce it. Is that right?
Yeah, that is very correct. Okay. Yes.
So what are you doing actually in Skopje these days?
So I am visiting one of our member associations, Hera, for 2 days to learn about the work, getting to know the team, meeting their partners, and seeing the impact that they do every day with their work and different issues. And of course, seeing how they operate in the very much changing political environment in the country and in the region. A lot of work to do, and so this is for me to see the inside scoop of the daily work and also how we as IPPF can support them as our member association, both from Brussels, from the regional office, but also as IPPF globally and connect with other partners and other member associations. We are present in 149 countries as a federation. In our region, Europe and Central Asia, we are present in 40 countries. So, of course, Hera is part of a big movement, human rights, SRHR, sexual reproductive health and rights movement. So it's a real pleasure to be here.
I have to be honest, I'm a musician and I was not into it very much. So I had to learn something and read about what's happening. And half of the questions actually I wrote for today are in terms of what's happening with all this global changing, and which actually I think started in America these days. What do you think about it?
Well, it hasn't
I know it's
started.
an issue that we can talk about.
Yeah, I mean, we can take, a very long time to discuss it. It hasn't started in the US. This is the latest explosion, if we want to say like this, but we have been seeing the changes slowly creeping in many different places, including Europe, from elections that didn't go very well or started to go into the right, slowly every time. So, this is what we're seeing with Trump and the US is just a kind of pinnacle of the right-wing extreme voices coming to place and having a huge ripple effect on people's lives, real people's. It's not about, politics or arguments in the parliament or Congress and so on. These changes, these cuts of funding impact real people and their lives. And this is what those politicians keep forgetting. It's about, maternal mortality. It's about HIV treatment, testing, abortions, unsafe abortions, education for kids, bullying.
Yeah, we talked about it a lot of time in this podcast.
Yeah.
On different issues and different themes. So let's start from the beginning.
Tell
So
me.
after 17 years of experience and work in the field of human rights, with a focus on sexual orientation, gender equality, non-discrimination, inclusion, etc., what are your challenges and the difficulties you face today? I mean, this is one of them we're talking about.
Yes.
We'll get into that, but mostly, where to start, huh?
Yeah, where to start? It's a huge question. And, I was grateful that you shared some inside scoop on the question and the focus that you would like to discuss today. And it was really hard to have a sentence about it, what the challenge is. It's from, politicians that don't listen to the panic, imaginary panic around gender and who people are and what lives we should be leading, according to whom, to kids not being able to get education and information that they deserve and they need to become, healthy human beings that can lead informed lives. So it piles up, cuts of funding to organizations, to democratic systems. I mean, the question is big, the answer is almost as big as the question. So I'm hoping that we can dive in a bit.
Are these the hardest times of your job, let's say like this?
Since I started in 2005, so I'm celebrating 20 years this year. This is the most challenging and confusing time, because there were, of course, tough times, and we had to do our work and focus, and times were not easy, but these times are unprecedented. We haven't seen crackdown on, human rights, if you want to kind of put it in a bag like this before. So overarching. So it's challenging. It's challenging.
Can you give us some, let's say, like examples of what's happening? The cases, let's say, you face with these days.
Yes. So I mean, let's say we can take examples of different policies that are being introduced. One of the things that IPPF works quite a lot on, and HERA as well as our member association, is comprehensive sexuality education. So it's education for young people in schools, which talks about consensual relationships, safer sex, gender-based violence, what it is, how not to perpetuate it, gender norms, how to be well-rounded, healthy human being, and how to make decisions about your body. So this is what kids and young people need in their lives, just like they need other subjects in schools to become
What is
adults.
it like in Poland, let's say, talking about the sexual education in schools?
It's not part of the formal curricula, so it's done by civil society mostly, if it's allowed. It's not allowed in schools mostly, so it's very much voluntary in terms of teachers would call civil society to do a training or a session. There are other countries like Sweden or the Netherlands where it's more integrated in the curricula in schools, so that young people get the comprehensive part of education. So those policies and those programs are being attacked And teachers and parents are fed misinformation with a lot of fear that, you know, my child will become this or will have information about negative information impacting their lives. What they do forget that kids get a lot of information from social media. You know, their phones are attached to their hands nowadays. They get information if they want it or not. We need to make sure that they get the right information so they can make the right informed decisions for themselves.
There is a conference in 1 week from now, and actually they invited me to talk about and to choose a subject, and this is one of the this is the subject I choose.
Okay, perfect.
So young people and misinformation in the medias and online, you know, misinformations they get all the time, because I'm a parent of 2, so I know what's happening there and in the interpretation of that. And usually it's not the right thing. It's not true what they're saying, what they're sharing with their friends, and blah blah blah. And this is a never-ending process, and nobody's actually, you know, it's always like discussion about it. Should it be in some kind of censorship or not? You know, talking about the subjects they go on online. So what do you think about it? Should it be controls in a way or not? I mean, not like in North Korea, let's say, but...
So the information, you know, there are technical guidelines on how comprehensive sexuality education should be done in schools for the young people, kids and young people. And it is based on science, fact-based, yes, so this is what we should follow. So a broad answer to censorship is a no. It needs to be age appropriate, you know, how kids develop and what they need at that time. And those technical guidelines provide that guidance to teachers and parents. So that's what we should follow. Censorship and control never worked. And that we know, also scientifically proven. And on the other side, if we try to control kids, they will find the information if we want it or not. Nowadays, the information is there, and you said it yourself. So I think it's smart from our side to provide the information in a safe environment when kids can ask, like, is it correct? You know, this is what I'm feeling. What is it? Is it normal? You know, like, these are questions that young people are struggling with, and we need to support them with the answers.
What about the parents? We're struggling with them too, because usually they are the one. I mean, I don't know how it is in Poland, Sweden, Germany, or whatever, but here in Macedonia, I think that most of the parents don't know much about. We were discussing about this many times. We had like different subjects in the podcast, but most of the parents don't know what is the true information, what is the false one.
Of course.
So how do we fight? Let's not say how do we fight parents, but all of this ambient and situation. What do we do?
Yeah, and it's a brilliant question. What we need to do, we need to support parents. There is so many things that, you know, we don't know as parents, as partners, as siblings. We need to provide information. So, you know, organizations like HERA have materials, have resources, have clinics and services where those answers can be provided. And there is safe space in different ways where parents can reach out and ask. And I think one of the things we should be doing more is to actively...
Do you think that parents will ask?
Some will.
Some?
I think some will. And I'm hoping that when they do ask, they will share with their friends and other parents, and they can have conversations. And, you know, I believe in parents wanting good for their children. I don't believe that any parent want to harm. They always come from a good, you know, caring space, and they wonder, and they worry, and that's, you know, perfectly fine. That's the parent's job, to worry and provide good, you know, conditions for their children. What our job is to support them in supporting their kids in their well-being.
Okay, let's get back to the questions because I started again with my way of doing the podcast, going around it. But I read something about in your CV about this Agenda 2030. What is it actually?
Yes.
I don't know.
Yes.
Or I know just a little bit about it.
Absolutely happy to talk about it. So it's a global agreement done by all the member states of the United Nations. It was adopted in 2015. It's a plan for the world, if you will, for 15 years, so till 2030. It is composed of 17 goals. And each of those 17 goals addresses the critical challenges that the world is facing, or what we were facing in 2014, 2015 when it was negotiated. And it's everything from gender equality to quality education to climate, trade, partnerships, finances, poverty. So very, very comprehensive. It has very specific sub-goals and the focus. But the main idea is that all countries agreed to work on those specific challenges together to address both nationally and internationally how to improve it. So the unique thing about that agenda, the Agenda 2030, was that it was for all the countries. So it didn't matter if you were Sweden, Guatemala, or Jamaica. All the governments at that time agreed that we all have homework to do back at home. We would be on different levels and we would have different challenges, but we all had homework to do and fix different things back at home. So, after the adoption in 2015, there is annual kind of check-in. All the countries come together again to see how we are doing on achieving each of the goals. Each time they review 5-6 goals to kind of zoom in to see where are we, what are the good practices that we can share across the regions, different countries. There are some regional collaborations taking place as well. When the 2030 agenda was adopted, it was a very unique year. It was 2015 when the 2030 agenda was adopted, the Paris Agreement as well on climate was adopted, and a couple of other agreements. And we were in a very good place as a world. The agenda is very comprehensive, it's very inclusive, the language is really, really good, encompassing all of us. And what is striking to me when I compare 2014, 2015 to now, which is how many years in between? 7? We would have never been able to adopt this text today because the countries and the political situation is so polarized. We don't agree on the basic
I'd like
things.
That question too, because you said every country had or government had their homework, but are they doing their homework? Are they finishing it or?
Well, this is this specific agreement and some other agreements that come from the UN. This was consensus based, and that was very important that this agenda is agreed without a vote. So we had something that everyone could agree on and participate. Then when it comes to, doing the homework, it's on different level from different countries at different times, the governments change, but that's with everything. So this is nothing unique necessarily. The most important thing for me being engaged in both the negotiations and then monitoring it from civil society side was that countries were doing something. For instance, there are examples of policies being changed. countries were excited to share, okay, you know, this is what we did with gender equality, this is what we did with education, this is what we did with climate goals, and so on. And there was conversation. It's not to the level that I would like to do, but I am an activist. My job is to be dissatisfied and push the envelope and push the development so that people have better lives. That's my job. So as much as I, you know, engage and appreciate the work, we're not there yet. And we're not going to be there soon. Okay. But we need to keep at it, because otherwise, you know.
Okay, so next question comes naturally after this. What do you think about, talking about the experience you have for 20 years, where is Macedonia and all these Western Balkan countries in this area or field, let's say?
Yeah.
What do you think about it?
What am I thinking about it? You know, one of the reasons why I came to Skopje this week with a colleague of mine is to kind of have the first raw experience of what is happening in the region, because this is not a new phenomena, but it has its regional flavors. So, you know, with the political changes that we are seeing in North Macedonia and in the region and in Europe in generally, and then, you know, it's a ripple effect. It's the same pattern. So, you know, the right wing coming into power, very, very strong anti-gender, anti-rights movement, very emboldened, very well financed, very well organized. In a very, very short period of time, we can see how that impacts both the policy development laws, as we also see with the primary education law just this week, and also impact on civil society and the attacks and push for changes in the narrative when it comes to gender, you know, creating this fear-mongering around what gender is, who people should be, looking at equality as equality between women and men, but forgetting everybody else because it's dangerous. This is not helping. And this is, you know, what we're seeing in this country, but also in countries in the region and outside. And I think, you know, this has been coming. It has been long time coming. We're just seeing a very emboldened movement. And, you know, this hasn't happened overnight. This has been bubbling. And what happened with the US, Trump returning, this gave an excuse for certain narratives to be fine in public. You know, some years ago, it was not okay to be, I don't know, homophobic, chauvinistic in public, or it's fine. You know, it became so normalized because someone else started to use it.
I had a conversation with one of our fans of my band. I was talking to her and she said, like, we're thinking with my partner to move to Europe because they're really afraid of what's happening in America. Is that so? Is
Absolutely.
like that right now?
I can give you an example. 2 weeks ago, I was in the Netherlands for a meeting with our member associations, and we visited Amsterdam Center for Sex Workers, and they were sharing, you know, what they do, how they work, all of those services that they provide. One of the things that they brought to our attention was that, you know, they also work with migrants and refugees. What they notice is that a lot of trans people from the US are coming to the Netherlands as, you know, well, they're not going to get a refugee status for other reasons. But, you know, people are escaping because they don't feel safe. We know that, you know, people are losing their passports that recognize their, you know, gender identity that they are. The passports are automatically reverted to the sex that they were assigned at birth. Their names are being changed. They cannot travel. The people are scared of that, of institutional violence, but also violence, physical, that happens on the street because it has been normalized, because trans people and other people who don't fit in whatever, the US or other places,
But on the other
they are
hand, do you think
vilified.
that Europe is more safer place, let's say, in different regions? I mean, Netherlands is one part of Europe, but also we have like Western Balkans
Of course.
and countries like, I don't know, where, there is a big campaign of making these fears and everything. on
Absolutely.
that.
This is as challenging question as, where are we now in the world? I don't think it depends who you are. You will feel safe or not depending who you are. For instance, for trans people, it's very few places that one can be safe. If you're a Roma person, I assume it's also the case. If you're a young woman, probably you will feel safe or not depending where you are, on what time of day you move around, with whom are you alone. So I would say it has never been very simple answer. These days it's even more complicated to answer, because mostly because of the narrative of who is seen and portrayed as dangerous to different groups of people. So I think I will just
Do you think
leave
it all
there.
started with America and spreading around the world? I have some kind of feeling like this, especially after Trump's inauguration and everything.
I don't think it started there.
I mean, it didn't start,
it
but started very
allowed-
aggressively after.
Yes,
after that.
absolutely. This allowed the explosion of hate. And I was thinking about it, the difference between the first mandate and now when he returned to the White House. The first mandate was, he was testing the ground a bit, like testing the temperature, like what is okay, what kind of responses he would get on different, statements or policies. Now it's, the door is open. There's no shame, there is no regard, there is just, I'm gonna do it. So this obviously opened the door and allowed other, politicians or governments to say, okay, so if he can do it, why not? There are a couple of countries that when Trump signed the executive order on, recognizing only men and women and trans people don't existing, and then also banning the gender affirmative care, there were other countries saying, so we're gonna remove gender equality. We're gonna do equality between men and women because this is what's happening there. It's okay to do it. So, in a way, I would say still it hasn't started there. It allowed the escalation and the madness to unfold. I don't have any other words to describe what I'm seeing.
So what's
and what
next?
I'm hearing. What is next? We continue. Like I said at the beginning, I'm an activist, so I don't believe in just resting. We continue organizing, we continue supporting each other. That's the moment to come together even more. Here with Hera, we have a perfect example how the different communities and different organizations can work together, and the strength is in togetherness. So we don't have a luxury of being unfocused, maybe that's the word, and we push and we organize.
And talking about the cutting the funds, do you think it will impact in a big way all of this struggle and fight?
Of course, and we can see how it has already impacted. We will be releasing some information from IPPF side, talking to our member associations. But, considering the cuts and how many... So IPPF is present in 149 countries, as I mentioned. It's 40,000 clinics and service providing places. We're estimating that millions of people will not get services because of those cuts, because some of the clinics will need to close. Staff will be impacted.
It was like when USAID actually cut the funds. I mean, not exactly USAID, but I think Trump cut the administration. All these funds for Macedonia and for Skopje and for the schools, for the in public opinion, it's like, okay, so this gender campaign and all of these campaigns will stop, and this is what we wanted.
Yeah.
Blah blah, but they didn't know that also the schools, the kindergartens were supported by
exactly
all of these funds. But people are not familiar with this. They
exactly.
don't know nothing about it.
So earlier today I was saying that what we see in the news is the numbers. So how much money, how much percent, how much. What we are not seeing enough is the human stories of what happens when a clinic in a country is closed. What happens with, HIV testing, HIV treatment, women who are pregnant and need to deliver, and that clinic was the only place where they can do this. What happens with a person who needs abortion and the clinic is closed? Well, the abortion will be unsafe, and we know what can happen. Exactly, what the risks are when those services are done in an unsafe context by untrained people. What will happen with the rate of HIV infections if we don't provide prevention, so contraception or condoms or PrEP?
Yeah, we had a whole podcast talking about this.
There you go. So
experts,
this is what we will, the effects or outcomes we will see in a couple of years, right? Because, this will be piling up. But we can predict, all the technology around biomedical prevention of HIV, it's available. And if this is cut, this doesn't need a very elaborate analysis, right? Maternal mortality will go as well up. So there are human real consequences of those decisions that are made very far away based on something that is just unreal.
Maika, we had 50 questions for this podcast, but we don't have that much time. So
I can come again.
Yeah, you will come again.
There you go.
And take a day off, plus besides all of these conventions and meetings and everything else. I would like to ask you in the end, what is your greatest success as a human rights activist during these past 20 years, let's say? Or there is a period coming now that
I have two answers to this question. One answer is to be alive. The second question is, the people that I have engaged in the last 20 years, the trainings, the meetings, the strategizing, the crying, the laughing, this is power. And that shows me, when I think back at it, this is how we change things. Because we are stubborn and we are focused. We know where or what world we want to see. So, my achievement is just sticking at it. And the policy changes and the big UN processes that I was part of, these are great and I'm extremely proud of. And it's not the moment in time to talk about it, but sticking to it and working with colleagues is the best thing that I've done and that I will continue to do.
Okay, for the end of the podcast, do you have a message for the viewers of this podcast? Let's say. I usually say is there is something that I should be asking and you should be
mobilize, and don't stay quiet if you don't like something. We need voices in different ways. We can be using art, music. There you go, music.
I had so many messages through our songs.
Graffitis, cook dinner and talk about things. Organizing doesn't mean that you need to be on the street, but you need to keep at it. You need to make your voice heard in whatever way you can and whatever medium works for you. Hera is here for you, for young people, for older people, communities, because otherwise we are,
we are stuck in the middle.
We're stuck in the middle, and it's not really great middle these days.
Yeah.
So quiet doesn't work. It never worked, but these days it definitely doesn't work.
Maјка, thank you for coming to
so
our
much.
podcast, Quiet Noise. This is the correct, мислам дека правилно го предав, Let's say Тивка Врева or Quiet Noise, and expecting to see you next time with more time having for something like this.
Thank you so much for having me.
Тоа беше уште едно издание на Тивка Врева, дами и господа, се надам дека уживавте, а ние продолжаваме понатаму и со другите теми.